Welcome to the May Lunch and Learn for Connect. Today we'll be hearing from a few different chronic disease prevention and health promotion folks in the community who are also on the Connect system. And then we'll do some Connect updates, and then we'll have time for open introductions and chat. So first, I'd like to invite Melissa Baker to talk about her programs.
I'm Melissa Baker, as Julie just stated, and I work at Lewis and Clark Public Health in the prevention. I'm part of the prevention team there, and my specific focus is cancer prevention. I am a health educator in the cancer screening program, which is also sometimes called the breast and cervical health program. And what our primary focus is to provide free breast and cervical cancer screenings for women who do not have insurance and who meet specific income guidelines. But we also, or women who are underinsured. So if they have a high deductible, we can also serve them. We have also recently added a focus on patient navigation, which means that women who do not qualify for our program, but who are in need of a PAP or a mammogram, if they need help getting that set up, or if they need follow-up because they've had some sort of they need some sort of diagnostics, we can help them with that too. One thing that's really nice about our program is that even though it's called cancer screening program, if a woman has services and anything comes back abnormal, we do also cover her diagnostic services all the way up to the point of a cancer diagnosis if it comes to that. And if it does come to that, there is a special Medicaid program that is only for women who have gone through our program. And the guidelines to get onto that Medicaid program are a bit looser, higher income limit and no resource limit and so forth, unlike the traditional Medicaid. So that's cancer screening. And then the other thing that I do is I teach, and there are a couple other trainers in the Helena community, some over at RMDC. I teach these classes that are sometimes the easy name is Living Life Well with a chronic condition. They're also called chronic disease self-management classes. And they're for anybody who, as you might guess, has a chronic disease or a chronic condition such as arthritis or asthma or MS, basically anything you can think of. We've had some people come through the class with some very interesting, more rare diagnoses. Also for people who have anxiety or depression, and also for their caregivers. And the focus is again on providing them tools to self-manage their condition. And we go over a variety of modules. It's a 6-week-long class. We meet once a week for 2.5 hours, unless we're doing it at your work site, which we could modify it a little bit to do it for state employees, county employees, like St. Peter's if they wanted, any larger group, and then we shorten it to like 2 lunchtime periods. But anyway, we go over a lot of things like some things that seem really basic, like, you know, just getting a good night's sleep, dealing with pain, dealing with fatigue. But we also talk about using your mind to manage conditions, developing some distraction techniques when you're feeling a lot of pain. And then the nice thing about the class, another really nice thing about the class, is that it's very participatory. We do brainstorms. We usually do 3 or 4 brainstorms during each class. And all of the participants are encouraged to add to the brainstorm. And the people who've been through the class have all but one have reported that they've learned a lot from it, and that they really liked having the sense of support from the other members of the class that they're taking. So that sums up my 2 programs.
Great, thanks so much. Any questions for Melissa about the programs? Great. And of course, if you have questions, you'll be able to find these folks and connect, or feel free to send them to me and I'll route them to the right people as well.
When is the next Living Life Well class, Melissa?
That's a good question, Jess. What we do is we take referrals, and then when we have enough people to put on a class is when we do it. So right now there's nothing scheduled. And then I have been offering the class about once or twice a year to state employees. And that's usually set up through someone at the state who like books the room and everything for us. But yeah, we would love to be doing one community-wide one anytime. We just have to get enough people signed up.
And then they could get signed up through people referred to you.
Correct.
Yeah.
Through the referral system, the Connect referral system, or if they don't know about Connect yet, which we hope that they will, but yeah, they can contact me directly at my work. Yeah.
Thank you.
Great. Next up, we have Mary.
Hi, everybody. I'm Mary Pierce. I am the home visiting supervisor at Lewis and Clark Public Health. And we have a number of home visiting programs, but today I'm going to focus on our Montana Asthma program and give you a little bit more information about that. After we are done, if you do have any other questions about other home visiting programs, I'm happy to talk about those. I just want to kind of focus on what we're talking about today. So I'm going to share my screen just so you can see. Oops, it looks like, Julie, can you enable screen sharing by any chance? I'll try again here. Oh,
Yep,
there we
try
go.
that again.
Then I'm going to try to find what I had pulled up, and now I can't see it, of course. Let me just see if I can find it. One second. Oop, sorry, guys. Okay, so hopefully you can see all that. So the Montana Asthma Program is in a number of counties in Montana, not all of them. There is, I can actually go to a different page and show you the counties that it's available in, if it will let me. But anyway, in Lewis and Clark County, we are able to do 6 home visits a year with one of our nurses. Our nurse home visitors will go into the home and when we're allowed back in the home, I should say, and assess what some of the triggers are for asthma in the home. And you can see on this screen that there are a number of things that are available to families when they assess what the needs are. So things like mattress covers, air filters for home. We will go in, identify what is necessary to help control the environment and reduce the triggers for asthma in the home. Now, this was a program that was just available to kids for quite some time, 0 to 18, and now it's been expanded to cover any age, as long as their primary diagnosis is asthma. That means they can't have a primary diagnosis or a diagnosis of like COPD or emphysema, because our nurses are not equipped to handle those things. So if asthma is their primary diagnosis and they're having uncontrolled symptoms, spending time going to the emergency room, we are happy to take those referrals. There's no cap on the program. We have to serve at least 15 I think it's 15 families within a year, which we do pretty easily, but we can certainly serve more. So again, it's 6 visits per year. Hopefully we are getting them in, controlling some of those triggers, and then they don't need us anymore. So we're happy to take those referrals again through the Connect referral system. It is located in Lewis and Clark, Montana, Lewis and Clark County, Montana Asthma Program. And I was going to show you the screen that shows what counties it's available in. So Lewis and Clark, Cascade, Flathead, all the ones in blue that you see are areas that we don't cover all those. We just cover Lewis and Clark, but we can certainly connect you with those other counties that do that if you have clients that could potentially live in those other counties. Any questions for me? I can send that link to the website to Julie to forward out if you'd like to see it. And we do have flyers if you would like to have some rack cards. I can get those to you somehow. Any questions?
Thank you, Mary.
You bet.
Next, it looks like Carol just joined us from Dynamic Health. Carol, are you ready to jump in?
I am. How are you?
Thanks.
That was close. I actually had to go to the international connection. I have no idea why it didn't connect faster, but such is the case. So I'm going to see if I can't connect on my, hold on just a second. Is that better?
Yep, that's fine.
Okay. Disconnecting on the phone.
Okay, great.
Very good. Well, it's nice to see everybody and put names together with faces. I love that. I also would love to be able to share a screen, if that's okay, Julie.
Yeah, you should be able to.
Okay, great. So at Dynamic Health Technologies, which I'm actually at home today, but with Dynamic Health Technologies, our goal is to just use different technologies that help people heal faster. So it's not about a set treatment or protocol or anything like that. It's just about creating healthy people. So I thought I'd share with you my website. Nope, it's not going to let me. I think I have too many other things going. Nope, it's okay. So some of the technologies that we use is a biofeedback system, which is a computerized scan of the body. And we actually have 4 of those different systems. Then we have hyperbaric oxygen therapy, which some of you might be familiar with. The hyperbaric oxygen is phenomenal for neurological conditions, starting with, you know, kids with autism all the way up to elderly people with strokes, wound healing, diabetic ulcers, things that don't heal well, and any time that they need to get the inflammation down. So sometimes we have injuries or wounds that need accelerated healing. Sometimes we have people with arthritis, regardless, osteo or rheumatoid, but particularly rheumatoid has been really amazing in the hyperbaric oxygen chambers. And then we have an H-wave, which is, it's kind of like a TENS unit on steroids. And it is basically 3 weeks of physical therapy in about 40 minutes because it contracts 100 times a minute. So it's all about really quick, fast ways to get people healthier. And then one of my favorite technologies is actually a technology called EECP, or Enhanced External Counter Pulsation. And what it is it's a table. It's semi-reclined, and then underneath that table is huge compressors that hook to blood pressure like cuffs that wrap around your legs and around your hips. So when your heart contracts, your cuffs are relaxed, but when your heart relaxes, the cuffs inflate and they give you a counter pulse. So If you're familiar with an internal balloon pump, this is an external version of that. And the EECP is basically 3 years worth of exercise in 35 hours. So it is really powerful, and we have the only one in the state. It's a cardiac rehab technology. They do require some screening to make sure it's safe. So we have Dr. Scott Falley is an internal medicine specialist who does those screenings for us, as well as safety screenings for the hyperbaric. So those are some of our favorite technologies, and we just love to help people get those results that much faster. So the biofeedback is especially amazing for dealing with stress, past stress, old traumas, new traumas, anxiety, insomnia, those are all, and pain management. Those are all huge things for the biofeedback. So would love to be able to connect with you and learn more. I'm excited to learn more about what you guys all do. So I think that's it, Julie.
Wonderful. Thanks so much, Carol. Any questions for her about dynamic health?
I have a question, Julie.
Go for it.
Carol, so do you serve a certain population or just anyone with that chronic?
You know, it
health?
really can be anybody. I have worked on 10-day-old babies. I have worked on, it just depends on the situation. My youngest client was 10 days old. My oldest client is 93. So, and I've been in business for myself for 18 years, but our corporation's been around now for 9, and we have 9 employees now. So it's still a small business, but growing all the time. And we don't focus on particularly treating a specific diagnoses. It's more what is blocking that person from becoming healthy, and that's what we're looking for, is to unblock the blockages as opposed to a treatment.
And then do you take all types of insurance, including Medicaid?
We took Medicaid waiver, but Medicaid waiver dropped us. And so we actually have had a lot of luck with people who have insurance. If they can, we'll give them a HCFA form and they can submit that and get it covered. And that helps reduce the cost for them. I don't submit to insurance, and Medicare and Medicaid's reimbursement rate, like for biofeedback, our normal charge is $150 for a first session and $125 after that. They're 2 hours long, and our rates nationwide are much lower than many places. There's practitioners who charge $350 per hour, $250 per hour. So our rates are really, really reasonable, and our Medicare reimbursement rate is $18. So it's
Okay.
yeah, it's cheaper for us to run a free clinic than it is to submit for insurance.
Yeah. Will you put in the chat your website?
Yes, I absolutely will.
Thank you.
Then also I should let you know that we do a lot with Impact Montana and with veterans. And because of the success we've had with PTSD and with the traumatic brain injuries, even mild traumatic brain injuries, the hyperbaric has been awesome for them, and they get a 20% discount. So we have a huge discount for them. And also if they qualify, Impact Montana will cover their costs. So
Great. That's good to know.
yeah, so thank you to Impact Montana for doing that. But that's a population that we've had a lot of success with and work with a lot. So I will share that in the chat box. Good question. Thanks, Charity.
And Carol, did you say whether a doctor has to give you a referral or a family can just call?
They can just call. We do have a physician screening that's necessary for the EEC, the hyperbaric. But for all of our other technologies, you can literally, anyone can just call. You can self-refer, you
Okay.
can refer, and we do give a $20, actually for this month, for June, we'll do a $40, our special is a $40 referral fee. So normally when our clients refer a friend or family, we give them $20 back against their account. I'd rather spend my advertising dollars there than trying to put up a billboard. And so that's been really successful, yeah. But
Okay,
yeah,
thanks.
be for themselves. Anybody else?
Right. Thanks so much, Carol. Next up, we have Jamie Larice.
Can you hear me? Yeah, okay. My name's Jamie Larice. For those of you who don't know me, I'm a registered dietitian by trade, but I am the wellness promotion developer and educator at St. Peter's Health. I am also a former smoker, which is why I have been really adamant about bringing an evidence-based tobacco cessation program to St. Peter's. I'm sure, as Melissa knows and everyone in Lewis and Clark Public Health knows, that tobacco use, whether it be smoking or chewing or even e-cigarette use, is really high in our state, and it costs us a lot of health dollars. So I connected with Julie to make sure that our referral into the program, we do require a provider's referral. And the reason being is that we want to make sure that the provider is aware that someone is trying to quit smoking, because different medications can be affected by that. And also the evidence-based approach is utilizing pharmacotherapies. So there are 7 FDA-approved medications for quitting tobacco. And then along with the program is the behavioral dependency, which is the group participation. So we partnered with the American Lung Association, whose program, for those of you who don't know, is called Freedom from Smoking. We like to refer to it as Freedom from Tobacco because the same evidence-based approach can be used for all tobacco use, but the name is branded Freedom from Smoking. Our health system paid for one of their facilitators to come out last year, and we have trained facilitators. Right now we have 3 folks who are facilitating classes. They're small groups. We were able to modify and create the classes virtually, and that may be a model that we continue with for those people who may be disabled or may not have transportation or may live out of town. I do not expect someone from Townsend to drive in 1 day a week for the tobacco class. So again, we are on the Connect referral system. I can get those referrals. What I do is I then call the patient. I make sure that they are in the content or in the behavior change that they want to quit. If they're still in the pre-contemplation stage, you're more than welcome to submit the referral, but we will only take people who are actually ready to quit, and that can be difficult. We then, when they start the class, it's a 7-week class that actually has 8 classes, because week 4 is quit day, and then we meet again 48 hours later. We do utilize the help of our awesome clinical pharmacists. They come to the class, they review all the medications. Most people tend to be a little weird about the medications. Either they've tried them before or they just don't think they work. But it's pretty ironic that we want a pill for everything, and actually for tobacco there is a pill to help you with withdrawals. Of course, we also work on the mental and social aspects of addiction. A pill is not going to take away behavior. And so the clinical pharmacist will definitely work with St. Peter's providers to make sure that the insurance covers. In case you didn't know, the Affordable Care Act requires that all insurances cover these 7 FDA-approved medications. So oftentimes, the medications and the nicotine replacement therapies that include the patch, the gum, the lozenges, oftentimes there's a 0 copay at all, and people can get up to 5 refills. So oftentimes money can be a hindrance, but our clinical pharmacists will also work with I know they work with PeerView really well. So you can find that. If someone, please email me. You can go to St. Peter's website. I have a ton of brochures that I can most certainly push out to anybody who wants. And if someone is interested and they don't have a Connect referral or they don't know what to do, they can actually just go to our website, look up the tobacco cessation, and they can enter in an inquiry. So if you happen to have someone sitting there and for some reason Connect isn't working, you can go straight to the St. Peter's website and fill out an inquiry form. I will then receive that by email and I will give them a call. We've started this program since January. We have had success. Of course, I want 100% of people who are referred to come into the program, but unfortunately right now, probably about 20% have committed. But this is the most successful tobacco quitting program in the country. So let me know if you have any questions. I can drop off brochures, and please let the Connect system work for you to get those referrals in. Any questions for me?
Jamie, I just wanted to let you know that the health department does first breath smoking cessation for pregnant women. So that is a home visiting program. So it's one-on-one. If you have any pregnant women that are in your program and you want them to be able to access a little bit more one-on-one with smoking cessation, we can do that as well.
And sorry, please excuse me, I missed, what would I look up on Connect for that?
Oh, sure. It would be under Lewis and Clark County Health Department or Lewis and Clark Public Health. First breath, I think it's just under, is it Julie? I'm not sure if it says first breath or first breath smoking cessation, but it is just specific for pregnant women. And then it goes until like, yeah, 3 months after the baby is born. I was trained in as a facilitator for freedom from smoking and also in first breath. So it's kind of a mix of both, just so you know.
So similar approach though, utilizing the nicotine replacement therapies and behavioral counseling?
You know, yeah, it's more of the behavioral pieces of it and the education. I would only refer to other programs for the medication replacement. We don't do that within the health department.
Sure. No, that's great. I have a pregnant lady right now. So I will most certainly,
very good.
If she's interested in actually use the Connect and bounce her back. Thank you.
Yeah, you bet.
Any other questions? Okay, thanks, Julie.
All right. Thank you, Jamie. And last we have Jess Hegstrom.
Hey everyone. So I'm the suicide prevention coordinator for Lewis and Clark Public Health. So Julie asked me to tell you a little bit about the training that we have going. Jamie Larice happens to be one of our trainers. Hi, Jamie. Because we can only offer really a couple models virtually, one of them being QPR, which is a basic suicide prevention training. We call it a gatekeeper training, but it's basically like first aid for suicide prevention. So we're offering that virtually if anyone's interested in doing that. But we also have a partnership with the Awareness Network. If any of you are unfamiliar with that organization, they provide scholarships to youth for mental health services. And Julie's working to get them on to Connect, so hoping that'll happen soon. But they're awesome, and they are going to be providing $5 gift cards to the general public if they attend our training. So the next one that we have is on May 30th, so this Saturday from 10 to noon. In the chat, I just sent you all the registration link. It's free to participate. You get a $5 gift card for participating. It is that QPR program that I mentioned, so it stands for question, persuade, refer. Question if someone's feeling suicidal, persuade them to seek help, and offer hope, and then refer them on to the next level of care. It's 2 hours of your time, and it's just really nice to have a few extra tools because living in Montana, it's likely at some point that you're going to run into someone who is thinking about suicide or is just struggling. So great information. The other thing you should know with our connection to Connect is that I am on Connect. So if you have any clients or know someone that would benefit from attending this training, you can refer them to me. And this, like, I think about like if you had a family member who you were working with a client who's diagnosed with a mental health challenge, for example, and the people around them, their family members, wanted to learn some more information so that they could be better supports, this would be one way that you could do that. So I would give them this information, and then once we are out of virtual land and we can actually see each other, we have additional training that would be of assistance. So for example, a program called Youth Mental Health First Aid for if you have a teenager, for example, because it's very difficult for adults to tell the difference between what is normal adolescent development and what is a burgeoning or existing mental health challenge, because a lot of times they present the same way. We know about 86% of parents who lost a kiddo to suicide didn't know that they were depressed. So we're all about putting the tools in the hands of the people, and that's mainly, but you know, if you want to refer anyone to any of those trainings, again, I'm on Connect. And then anyone who wants to come to the training this weekend, please do sign up. And then we will honor your participation with gift card and many kudos. So that's it. Julie, was there anything else you wanted me to mention? Oh, I have one more thing if that's okay, but it's 12:32. It's up to you. Okay, so this made me think of you, Carol, because you do work with service members and veterans. So we recently launched the second year of our program called the Military Strong Challenge. And what it is a 90-minute self-paced virtual training. It's completely free to participate. And what we like to have happen is say dynamic health. Dynamic health signs on to become military strong. What we would ask is that 50% of your 9 employees take the training, preferably all of them. And then once 50% have taken the training, then your organization would be considered military strong. You get all sorts of certificates, letter from mayor, stickers, and window clings, and also you end up, for any participants who are already on Connect, they get their badge on Connect next to their stuff. That's correct, right, Julie? And then also in the 211 system, so in Montana211.org, also that logo goes there as well, so that anyone who's accessing that information knows that you have additional military cultural competency, military awareness. Because what it is 5 modules, 15 things every veteran wants you to know.
Actually, I'm so glad you reminded me of that because I've done this. So I've been part of joining community forces almost since their inception.
Awesome.
Yeah, they're fantastic. But I'm glad you mentioned this because I had done the military strong, and I had done this, I don't know, like 3.5, maybe about 3 years ago when they first started doing it. And so I had part of my staff, but and we were 50%, so we were military strong. But now I have more staff, and I totally forgot about having them do that. And 2 of them are already, one of them is a veteran, and one of them worked at the VA as a nurse for years and years. So,
awesome. Yeah,
I will do that. I'll visit that again. Meet up at staff meeting. Thank you.
Yeah, I can send you some information. And it sounds like maybe it was a similar program, but not the same as the one that we started, because ours is about 2 years old. But the benefit of you having already taken that training and some of your staff is if you guys jumped on, then any training you've already done, you'd already be credited for. So it'd just be a matter of adding some extra stuff if there's much to add.
If it's just an hour and a half, we'll just do it. We'll just staff meeting, order, and lunch, and it'll be done. We'll be 100% military strong.
That's awesome. All right, I will send you the information. Do you mind typing your email in the chat?
It's on there. Yeah, it's on there.
Oh, that was easy. Thank you.
I have a question, Jess.
Yeah.
Do you know who does the stuff in the school district for suicide prevention? Is that
for Helena schools?
Yeah, or I'm in Butte, Silver Bow, so.
Oh, gotcha. So when I talk to the Helena School District, it's Jocelyn Davis. And then we tell her about anything that we're offering, because we have a grant from SAMHSA to do mental health and suicide prevention training. But they have an in-house QPR trainer and one for assist that we work with on occasion. And then they are also doing the YAM program, which is through MSU. Charity, if you want, we could do a quick phone call today or next week, and I can just chat.
Yeah. I will put my email in the box. And then I also wanted to tell you the home visiting PAT group does group connections, and Mary is part of the partnership too. But this might be a good one for the home visitors, Mary, I was thinking. And maybe they could even coordinate it with a group connection, just a thought out there for PAT.
Yeah, that's good thought. Thank you.
Great. I love all these connections. I want to take just a minute and just let you know about what's happening in Connect. Nothing new in the system itself, but I want to remind you all in this time of everything being virtual that we do have an option to have your client or patient sign virtually the release via text. So if they're not in your office and you're just doing a televisit, you can do that. If you need a refresher, feel free to reach out and let me know. And I also want to put in a plug. I'm hosting a training next Friday at 12 p.m. targeted toward behavioral health providers, but open to anyone about the Connect system. So if you have behavioral health providers in your personal, professional networks, I would love if you would encourage them to attend this training. And then I know we're a little past 12:30, but anyone who wants to stay on and chat and do some introductions of those who haven't spoken yet, you all are welcome. And thank you very much to all of you who've presented about your wonderful programs. I appreciate it.
Thanks, Julie, for getting this together.
You're very welcome, Julie. But yes, thank you for the opportunity.
Thanks.
Thanks, Julie.
Thanks.
Charity, I just emailed you. And Carol will get you soon.
All right.
Hi.
Bye.
Everybody just log off. I was hoping to find out like who Amber was.
Amber is with, that's a good question. I'm going to stop the recording so I don't have to remember to edit this.
Okay.